All right, hi, I'm Dr. Erdman. This is Madison Vein and Laser, and this is an introductory video on endovenous thermal ablation of the great or small saphenous vein. This is our favorite patient, Stephanie, who's volunteered to help show us this today. What I'm going to be working on for Stephanie today is her small saphenous vein on the left leg. Stephanie just had her great saphenous vein done earlier this week. And just to give you a little bit of feedback for that, and Stephanie, you can chime in with whatever you felt, but typically people after that procedure, it's not bad at all. They say that you feel a little sore and tight, almost like a pulled muscle inside there, and that's because what's happening is the vein not only is going from a tube to a cord after the procedure, it's also shrinking lengthwise just a little bit. So typically people will say when they get out of a chair, get up out of their car, it tugs a little bit in there. And typically that's going to just slowly resolve over the course of about 7 days. And Stephanie's about 3 or 4 days out from that, so I don't know if you have anything to add to that, Stephanie?
It's very manageable, and I had very little bruising, and I would highly recommend it.
Okay. So what I'm going to do first is just take a look. We already have mapped her leg, so we've done a full ultrasound venous flow mapping. So I have a very good idea of where I want to go in, but I'm just going to reconfirm my entry point right now. So that's what you're going to be seeing next. And then we'll pause and I'm going to prep her skin afterwards, but let's just see what the best entry point here will be. Okay, so here on her screen, you can see the small saphenous vein running down the back of the calf. Here you can see a branch above it, and one of the reasons people get a lot of bruising after procedures like this is when doctors go through those branches and actually have a little bit of bleeding associated with the procedure. So if possible, I don't want my entry site to be through one of those little overlying branches. I'm going to go just a little bit above that, and then I'm going to mark it on her skin. So I just turn my probe, so instead of looking like a little circle, the vein lengthens out in long view. You can see it running right here at about 1 centimeter deep. And I'm just making a little mark on her skin so I can find that quickly later when I start the procedure. But that's the first part. What I'm going to be doing next is I'm going to go get some medication to sterilize her skin, so we'll pause here for a moment while I do that. All right, so we're back. I'm going to be sterilizing Stephanie's skin with a little bit of Dynahex right now. I like to warm it up for the patient so it's not so cold. And we're just going to go right over the entry site here and outward from there. I'm going to go higher than I'm going to be treating and also lower than I'm going to be treating. To get the whole leg. Does that feel okay, Stephanie?
Yes.
Okay. I'm going to lift up just a little bit. Okay, come back down. And then one final time over the whole area. All right, so we will pause here, and the next thing I'm going to do is get gowned and gloved and have Tracy help me draw up some of the local anesthetic we'll be using, some of the non-sterile things we'll be using during the procedure. And when we come back, I should be gowned and we'll be ready to start setting things out and going ahead with it. So we've got Stephanie all prepped and draped, skin sterilized. All my supplies are out on the table. What I'm going to do now is start moving things over to the table. I always tell people whenever we're going through a procedure like this, not to worry. I will always tell you before I do something, so you'll never get like a surprise poke or surprise pinch. I'll be talking you through the whole procedure. Most of what we do as far as any pain goes is just the little initial numbing medication with a very small insulin needle. So that's the majority of what people actually feel. And there's only a few of those throughout the whole procedure. So, and we'll get some feedback from Stephanie today, which will be nice. But right now I'm just going to be moving stuff over to the table in preparation to start. All right, so everything's laid out. Next thing I'm going to do is put a little sterile ultrasound gel on the leg and just find my entry spot. So a little cold gel here, Stephanie. All right. So the next thing I'm going to do is put a little wheel of topical right where I'm going to go in, and I'm actually going to come in just a little bit above where I had marked originally, and then I'm going to numb up the skin. And so what I do to numb up the skin is I'll place the needle gently down on the skin. So does that hurt, Stephanie?
No.
You feel my pressure though, right? Like you feel where it is.
Yeah.
So it just lets people know where I am, and then I'll say 1, 2, 3 pinch before I do the little poke. So here it comes, 1, 2, 3 pinch, and real quick, needle goes in, and I'm putting in that local. How does that feel? Does it feel okay?
Yeah, it feels just like a little sting. That's it.
So now the top part of the skin is numbed up, and what I'm going to do is take a little bit longer needle. It's not much larger as far as size, it's just a little longer so I can reach down to the vein, and I'm going to go right through that numb spot. So even though the needle looks a little bigger, it shouldn't bother her anymore. So a little pressure right in that area then shouldn't feel the pinch. Did you feel that when I went through there?
No.
Okay, and you can see on the screen, you can see my needle tip moving right there. What I'm going to do is put a little bit of topical right there down next to the vein, kind of filling that area up. She might feel a little pressure while I do that, but it should be minimal. Just,
Very
okay.
minimal.
Good. And then the next thing I'm going to do, so this needle looks big and long and terrible, and if people see this, sometimes they worry. She's not going to feel this. At the most, she'll feel just a little pinch when I go into the vein itself, and she may not even feel that. So even though that needle looks bad, don't let it worry you. So a little pressure right there. How's that?
Can't feel it.
Okay. And then I'm coming down next to the vein, and then you can see the needle tip right there, touching the outside of the vein. Can you feel that?
No.
So you may feel just a little pinch when I pop in the vein. So right here, 1, 2, 3 pinch.
I felt nothing.
Okay. So there you can see some blood return into the hub of the needle. So we know we're in the vein. I'm going to take off my syringe. I'm going to put a little 4x4 here just so the blood doesn't drip on her leg. I'm going to take my guide wire, and I'm going to go right into the vein. And so what the guide wire is doing here is just saving my place. Okay, so when we do the actual procedure, it's essentially a larger plastic IV that I'm putting into the vein. Okay, so now as you can see, we have the guide wire inside the vein, and that's just temporarily holding our place there. What I'm going to do is take a scalpel and just make a tiny little nick right next to the vein. So I'm just basically making a poke. So I'm going to go right along that wire and just poke, just like that. Because she's numb, did you feel that, Stephanie?
No.
She didn't even feel it, right? And that's the biggest nick that we will make today. And it's so small, it's 2 to 3 millimeters, that she won't even need a stitch or anything for that to heal up. And then right over that now, we're going to put in just basically a little bit larger plastic IV, and that's what the laser will be sliding through later. But we're going to put that over the top of the guide wire. So the guide wire is in the vein that we're going to treat, and that's guiding this little IV, so I'm just putting that in. Stephanie, did that hurt?
I can't feel anything.
Okay, and then I'm going to take my guide wire out of the vein. So now the plastic IV is in the vein, guide wire's out, and we'll pause there. So now, as you can see, I'm starting to remove the central spacer in that IV, and I have my laser turned on. You can see the laser's never turned on until it's actually inside that IV tubing. So I have it in the hub while I'm taking that out. You can see a little bit of return there. And then I'm going to advance my laser fiber through the vein. So I'm putting this in now. It's going to follow that vein right up. You can actually see the aiming beam right on the surface of the skin. And Stephanie, does that hurt?
No.
All right, so as it's going into the vein, people sometimes are concerned that it's going to hurt while I'm putting it in. It doesn't hurt, it's very smooth. And I'm just going to get this in my final position here, and then we'll go ahead and put in the tumescence, but we'll pause here. Okay, so here you can see that bright white line coming across my screen. That's actually the laser fiber inside the vein, just so you know where I'm talking about. So it's on my depth is at about 2 centimeters, so hopefully you can see that on the side of the screen. And you're going to see my needle come into the screen here in just a second, so a little pressure. I already numbed that spot up. So there you can see my needle, and I'm coming right down next to the vein, and what I'm going to do is start putting in that essentially water with a little bit of lidocaine. So there you can see it expanding around the outside of the vein. Is that hurting, Stephanie?
No, it's not.
Okay. So basically I'm just working up all around that vein. You can see that black, so here in front of my needle, that's where that numbing medication has already tracked up around the outside. So we're about halfway up. I'm going to come out of that. I'm going to do another little numbing spot here, so if you want to come back to her leg, Tracy. So right here, 1, 2, 3 pinch with the tiny little needle again that I use for that topical on the skin. Are those starting to be a little less pinchy, do you think, Stephanie?
Yeah, I think so.
Okay. You'll still feel them. It's just should be a little less, and then I'm going to go right through that numb spot, right back down to the vein. So if you want to come back over to the ultrasound. So again, there you can see my needle tip right outside the vein. Pushing in medication all around the outside of the vein. And one of the nice things, like sometimes people see that needle and they think that that long needle is bad or that they wouldn't want that. And one of the nice things about a longer needle, even though it looks scary, is it allows me to do a longer length of vein through one little poke. And so it's actually minimizing how many times I have to poke somebody on their leg. And again, it actually adds to the comfort. You would think maybe the opposite just because it looks a little bigger, but it really does minimize what we have to do as far as how many times we have to poke in there to get the leg numbed up. Next little pinch is going to be right here. 1, 2, 3 pinch. Little pressure right there. Again, next to the vein, flooding the area around the outside of the vein with that very dilute local. How you doing, Stephanie? Now at the top, actually, before you answer, let me just tell people, at the top of the vein, people typically say that there's a little bit more pressure. So whether it's at the back of the knee or the crease of the groin, if we're doing the inseam for the great saphenous vein, that topical or the tumescent anesthesia is typically going to cause a little bit more pressure right at the junction. And so what do you think?
Yeah, I feel like a pull, like a muscle pull in the back of the calf.
Yep. So that's real typical. Doesn't mean anything's wrong, but what I always tell people is if it's really bugging you, just tell me. I can slow down. The nice thing about these procedures is we're not on a clock. We're not having to race anything. I can slow down as much as you need me to make you comfortable. So it should be a very easy, comfortable procedure, or as comfortable as possible. You know, obviously nobody wants to have any procedure done ever, but this is a very, very low impact procedure. All right, so let's pause there. I have all the tumescence. Okay, so everything's in place, patient is numb. What we're gonna do next is turn on our laser and start the drawback, and this is actually what's gonna close the vein. You'll be able to see it on the ultrasound screen, so you can see everything here is good. I had to do 1, 2, 3 little pokes to numb her up after the initial incision, so a total of 4 to do this whole section of vein. So again, very few little pokes, very easy as far as that goes. So what I'm going to do is line back up over the top of the vein. And if you want to come to the ultrasound screen, Tracy, so you can see that bright white line, once again, right at about 2. I'm going to wiggle it a little bit there so you can see the tip. So that's the tip of the fiber. And what I'm going to do is step down on the pedal and the laser will start firing. And what I always tell my patients, I want you to be comfortable. So if at any point you're uncomfortable, tell me. It's as simple as me stepping off the pedal, You can hear a little bit, it'll be beeping, the laser will be beeping, eventually the cooling fan will come on, you can even hear a little crackle or pop as we're coming back out. All that's normal. Some people get a little funny taste or smell associated with the laser being fired, about a third of people, again, normal, that'll come and go. The main thing from my standpoint is I want you to be comfortable, so we're gonna start. So there you can see the tip of the fiber, and you can see how it's starting to vaporize everything around it, so that's sealing that being closed. How are you doing, Stephanie?
Good.
Yeah? Numb? Does it hurt?
No.
So now, as it comes back out, I always tell people at any point, if it starts to bother you, or if you start to feel like, hey, maybe that's hurting a little bit, just tell me. I can stop, put in a little more local, and that should take care of it. I don't want you to feel like you have to suffer through something. But yeah, so essentially at this point, we're on drawback. We're just watching come back out of the vein, and we're listening to Stephanie. If she has any discomfort, we'll pause and put in a little more local. Okay, so we're about halfway out at this point. Stephanie hasn't had discomfort from this. Again, she's numb. You can hear the laser in the background. The cooling fan has come on now, so that's what's a little bit noisy. You hear the beeping of the laser. We're just gonna pause. I'm about, again, halfway out. And I'll tell you the total procedure time when we're done here, but again, it's gonna take maybe 5 minutes of actual lasing. So we'll pause and get just the end of it, and then we'll wrap up. All right, so we're getting close to the end. You can actually come back to the screen. Right here, you can see the laser is gonna be angling up and away from the vein. And so basically, I'm gonna let that fiber come all the way back out. And that will basically seal up that little spot that I made on the vein. If you look here, you can see the aiming beam, and I'm gonna stop, okay? So once that aiming beam gets bright, I know that I'm out of the vein, I'm done with the procedure. Did that hurt at all, Stephanie?
Not at all.
Okay, so we're all the way done. What I'm gonna do is turn off my laser now so nobody gets affected by that light. And we'll pause, and then I'll show you how I clean up, and we'll talk about anything to wrap up. Okay, so we're done, fibers out, cleaned up the back of the leg. Again, you can see the 1, 2, 3, 4 little marks. This is my main incision site, so I don't know if you can get a close-up on that, Tracy, or if you want to come around here. But it's just a little vertical nick, maybe 2 to 3 millimeters in size. What I'm gonna do is take a piece of sterile gauze, and I'm just gonna fold it up and put it right over the top of that, because what'll happen now is, as the day goes on, she'll walk, and a little bit of that water that's in and around the vein is going to be forced out by her calf muscle. So I'm just going to catch it with that little 4x4. So I'll tape that down. She'll put a compression stocking on over that and wear the stocking for about a week. By the end of a week, her leg should already feel better. And that's sort of wrapping things up. I don't know, Stephanie, is there anything that you want to add to any of that?
It was pretty much painless, so I would highly recommend it.
All right, so we'll stop there. If I think of anything else that I want to add, we may do a final addition to this video, but otherwise, that's it. Endovenous thermal ablation at Madison. Okay, so this is Dr. Erdman. I just wanted to come back and do one last piece for that video about endovenous thermal ablation. I had mentioned during the procedure that I wanted to let you know how long the total lase time was. So once we got that data, that total section of vein took about 4.5 minutes during the actual laser on time. The total procedure time was about an hour, most of which was just prep, getting that local anesthetic in place, and then finally getting wrapped up, putting on the little dressing and the compression stocking at the end. So 1 hour total, and she's back up and walking, and she went back to work today. So again, very, very minimally impactful procedure, really easy. And it's nothing at all like the old surgical ligation and strippings. And just to finish that, I always want people to know, no matter where your friends and family members are, if you hear that a friend or family member somewhere else in the country went to a physician that told them that they needed surgery for their veins, please tell them to go get a second opinion, because it's very rare that anyone actually requires surgery for veins. And you'll hear those physicians say things like, oh, it's too big, or other excuses, and it's just not true. It's just that they don't offer other options. So it's not to further our practice here, it's just my little soapbox moment. Don't let your friends or family members have surgical ligation and stripping, and I'll end with that.